Hello, Assalamu alaikum. Dr. Nazim here. Today's video is a bit different. It is about how can you estimate the gestational age by doing a physical examination of a preterm neonate. So normally the score that is used for the estimation of gestational age in case of prematurity where you are not confirmed what is the gestational age. So in that case you take two parameters on the basis of which you estimate the gestational age of a preterm baby. One is the neuromuscular maturity and the other is physical maturity. After doing both of the examinations and assessment, you calculate the score, and that score tells you what is the estimated gestational age. Okay, so this score is known as expanded Ballard scoring system, on the basis of which you assess the gestation age by doing a physical examination. So this is the expanded new Ballard score that I am going to tell you, and it is used to determine the gestational age between 20 to 44 weeks. 20 to 44 weeks. So in the neuromuscular maturity, you see six things: posture, square window, arm recoil, popliteal angle, scarf sign, and heel to ear testing. So one is the posture, and the score is labeled from 0 to 5. So what is the posture? If the neonate is lying in supine position with both arms and the legs that are in extended position, so it is taken as 0. If the arms and legs are slightly flexed, then it is taken as 1. If the arms and legs are flexed at approximately at an angle of you can say 45 to 60 degree, so this is taken as 2. And if the arms and legs are flexed at an angle, so the flexion at the elbow is knee is making a 90 degree angle, it is 3. And if the angle is more than 90 degree, then this is taken as 4. So the score is from 0 to 4. Then comes the square window. The square window is usually seen at the wrist joint, that what is the angle that is being formed between the forearm and the palm. So basically what you do is you try to flex the hand over the wrist joint, and you see what is the angle that is formed after flexion. So if the angle is more than 90 degree, it is taken as -1. If the angle is 90 degree, it is taken as 0. If the angle is 60 degree, it is taken as 1. If the angle is 45 degree, it is taken as 2. And if the angle is 30 degree, it is taken as 3. And if there is no angle, there is full flexion, and the angle is 0, it means the score is 4. Then comes the arm recoil. How you estimate the arm recoil, how you look for it, is that you do extension, an active extension at the elbow joint, and then release the hand. So what happens, you look for how much recoil is there in the arm. If there is no recoil, you do the extension, and there is no recoil, the angle is formed is about 180 degree, the score is taken as 0. And if the angle is between 140 to 180 degree, it is taken as 1. If the score is less than 140 up to 110 degree, it is taken as 2. If the angle that is formed is 90 to 110 degree, the score is 3. And if the angle is less than 90 degree, it is taken as 4. So the score range for arm recoil is from 0 to 4. Then comes the popliteal angle. So popliteal angle is looked for by doing extension at the knee joint. So by doing extension, you look for how much AZ extension is there. If there is full extension, right, so it is taken as 180 degree. If the extension is about 160 degree, so it is taken as 1. If the extension is at 140 degree, the score is taken as 1. If the extension is about 120 degree, the score is 2. If the extension does not occur fully, occurs halfway, and the popliteal angle is about 100 degree, the score is taken as 3. If the angle that is formed at the knee joint is 90 degrees, taken as 4, and if the angle is less than 90 degree, so it is taken as 5. Then comes the scarf sign. So the scarf sign is looked for by moving the arm across the trunk. So you see at what point of the trunk the elbow is going to lie. So if the elbow is crossing the trunk to the other side, right, so it is taken as -1. If the elbow is not crossing the other side of the trunk, so it is taken as 0. If the elbow is just so if the elbow is between the midline of the trunk and the other side of the trunk, right, the contralateral side of the trunk, so it is taken as 1. So if the elbow is along the midline of the trunk, so it is taken as 2. If the elbow is not fully crossing the midline of the trunk and is proximal to it, the score is taken as 3. And if the elbow lies along the ipsilateral margins of the trunk, so it is taken as 4. Then comes the heel to ear testing. Heel to ear testing is seen by doing a full flexion at the hip, extension at the knee, and you try to touch the toes of the foot with the ipsilateral ear lobule. So if there is full flexion at the hip joint, so that the toe cross just is along the ear, ipsilateral ear, so it is -1. If it is not fully flexed and the toes or the foot is proximal to the ear, it cannot go beyond that, it is 0. If it is proximal to the face, so it is taken as 1. If it is if there is flexion at the hip and the foot is just in front of the trunk, it is proximal to the face, it is not in front of the face, and you try to do maximal extension at the knee joint and it does not goes beyond the trunk, it is taken as 2. If it stops at the level of abdomen, making a 90-degree angle at the knee joint, it is taken as 3. And if it is making an angle of less than 90 degree at the knee joint, so it is taken as 4. So this is all about neuromuscular maturity examination. You look for the maturity of the neuromuscular system. Then for each parameter you basically note the score, calculate the total score, and then add it to the physical maturity scoring that I am going to tell you just now after this segment, right? Here comes the physical maturity. The scoring system is same, -1 to 5, -1, 0, 1, 2, 3, 4, 5, and the parameters that you look for in the physical maturity are skin, lanugo hair, plantar surface, breast, eye and ear, genitals, and the genitals, whether it's male or female. So in the skin, you first look for the skin physical first physical parameter. If the skin is sticky, friable, and transparent, so it is taken as -1. If it is gelatinous, red, and translucent, it is taken as 0. If the skin appears smooth and there are pink visible veins, it is taken as 1. If there is superficial peeling or rash, or there are few veins, so it is taken as 2. If there is cracking or the pale areas and veins are really found in some part of the skin, so it is taken as 3. If there is parchment, there is deep cracking and there are no vessels, taken as 4. And it's a leathery, cracked, and wrinkled skin, so as in postpartum babies, it is taken as 5. So the lanugo hair, if there is no lanugo hair, if it is taken as -1. There's sparse lanugo hair, sparse, then it is 0. If there are abundant lanugo hair, it is taken as 1. If there is thinning of the lanugo hair, it is taken as 2. If there are some bald areas, it is taken as 3. And if there are mostly body surface is bald and very few lanugo hair are there, then it's taken as 4. So then comes the plantar surface. You look at the plantar surface of the foot and you look for the creases. If heel to toe no creases are found, then it is taken as -1 and 0. If there is faint red marks of the plantar surface, it is taken as 1. If it is only anterior transverse crease, it is taken as 2. If the creases are on anterior two-thirds of the foot, it is 3, and the creases are seen over the entire sole, it is taken as 4. Then comes the breast or the breast part. If there is imperceptible breast, it is taken as -1. Barely perceptible, 0. If there is uh, flat areola and there is no bud is being formed, it is taken as 1. If there is stippled areola about 1 to 2 millimeters, so it is taken as 2. If there is raised areola and the bud is 3 to 4 millimeters, it is taken as 3. And if there is full areola with the breast bud about 5 to 10 millimeter bud, so it is taken as 4. So then comes the eye and ear. If the lids are fused, and then you are going to see if there is tightly fused lids or loosely fused lids. If there is a loosely fused eyelids, it's taken as -1, and if it's taken as tightly fused lids, taken as -2. So if the lids open and the pinna is flat and stays folded, right, there's no elasticity, so it is taken as 0. If there is slightly curved pinna and there's soft or slow recoil, it is taken as 1. If there is slightly curved pinna and there is soft slow recoil, just as previously, it is taken as 1 to 2. So if it's firmly formed ear pinna and there is instant recoil, is 3, and there is thick cartilage and there is ear stiff, that is taken as 4. Then the genitals in the male, if the scrotum is flat and smooth and no rugae, it is taken as -1. If the scrotum is empty, no testes, and only faint rugae, it is taken as 0. If the testes are seen in the upper canal and the rare rugae there, it is taken as 1. The testes are descending with few rugae, 2. If the testes are down and there are good rugae formed in the scrotum, so it is taken as 3. And if the testes are pendulous and their deep rugae are seen, it is taken as 4. In the genitals in the female, you see if there is prominent clitoris and the labia are flat, is -1. If the clitoris is prominent and there is small labia minora, it is 0. If the clitoris is prominent and there are enlarging minors, it is taken as 1. If the majora and minora are equally prominent, it is taken as 2. Majora is large, minora becomes small, so it is 3. And if the majora covers the clitoris and minora, it is taken the mature genitalia in the newborn. So the maturity scoring, how you are going to estimate from the scoring system. So basically you calculate and then add both the physical and neuromuscular maturity, and you get the score. If the score is -10, so estimated gestation is 20 weeks. If it is -5, it is 22 weeks. If the score is 0, so the weeks are 24 gestational of age. And if the score is 5, so the estimated gestation is 26 weeks. If the score is 10, the estimated gestation is 28 weeks. If it is 15, then the estimated gestation is 30. So all the way you go up to 50, the maximum gestational age comes to be about 44 weeks. So this was all about the expanded new Ballard scoring system. It was just an informative video about what parameter you see, how you see it, and how you interpret the score that you calculate from both the parameters. So one thing I forgot to tell you, that this score needs to be done within the first 24 hours of life, because if you delay it, the parameters rapidly change, and the chances of error in estimating the gestational age increase many folds. So this needs to be done in the first few hours of life ideally, and if you are unable to do because of some hectic schedule, you can do it in the first 24 hours of life. Ideally it should be done in the first few hours of life to have the best accuracy in estimating the gestational age. So this was all for today. We will be back with another video. Stay tuned to the channel, share the video and subscribe the channel and like the videos. Thank you.